Don't ignore even one episode of chest pain. Watch the next video now to discover 3 warning signs you should never ignore and get your free ebook, 7 Secrets to Prevent a Heart Attack. Hit like, share, and subscribe so you don't miss out, because every minute you wait could make all the difference. My friends, many people over 50 have told me the same worry. Doctor, sometimes I feel chest pain and my heart races. Is it a heart attack or just anxiety? This is such an important question, because the two can feel very similar, but one can be life-threatening. A heart attack happens when blood flow to the heart is blocked. The pain is usually heavy, crushing, or burning. It lasts more than 10 minutes, may spread to your left arm, jaw, or back, and often comes with nausea, cold sweats, or shortness of breath. An anxiety attack, on the other hand, is triggered by stress. The chest discomfort is real, but it's often sharp, comes and goes, and usually improves after you calm down. You may feel shaky, dizzy, or panicked, but unlike a heart attack, the pain often fades within minutes. So how can you tell the difference? Remember this rule. If chest pain is severe, persistent, or comes with nausea, sweating, or pain spreading to other areas, call 911 immediately. It's better to be safe than sorry. For anxiety, slow breathing, relaxation, and rest usually help. But with a heart attack, every minute counts. Fast medical care can save your heart and your life. So don't ignore chest pain. Knowing the difference between a heart attack and anxiety could save your life or someone you love. Hi friends, today I'm your doctor. Wondering if your chest pain is stress or a heart attack? Remember the golden hour. The first 60 minutes when fast action saves heart muscle and lives. Heart attack. What it feels like. Pressure, squeezing, heaviness in the center or left chest. 5-10 minute in waves. May spread to left arm, jaw, back, or both arms. Often with shortness of breath, cold, clammy sweat, nausea, lightheadedness, unusual fatigue, especially in women and older adults. Usually not a heart attack. Anxiety, panic, sharp, brief stabs, fast breathing, tingling, eases with slow, deep breaths. Acid reflux, GERD, burning after meals, sour taste, better sitting upright, antacid, muscle rib, pinpoint pain, worse when pressed, twisting, or deep breathing. Red light. Act now. 5 to 10 mind pressure, spreading pain, or SOB, cold sweat, nausea, faintness. Treat as heart attack. Don't wait. Why speed matters. Golden hour. Every minute without blood flow injures heart muscle. Call 911 for on-the-way care, EKG, oxygen, maybe aspirin, and a ready team. Don't drive yourself. 3 life-saving steps. Recognize the signs above. React. Call 911 now. Sit, lie with head elevated. Loosen tight clothes. Stay on the line. Records. If possible, prep med list, allergies, conditions. Unlock the door for EMS. Special note. Women, older adults. Less chest pain, more SOB, fatigue, nausea, back, jaw discomfort. Call 911. Prevention, 1 line. Walk daily. Eat veggies, whole grains, beans, fish. Quit smoking, sleep. 7-8H manage BP, cholesterol, A1C. Dear friends, I'm a U.S. physician speaking to those over 60. If light tasks leave you unusually exhausted or short of breath, pay attention. My patient Mary thought her nighttime heartburn was just the stomach, but it was her heart whispering. Picture this. At the grocery store, a cold sweat, lightheadedness, and a subtle chest heaviness. More like a squeeze than pain. In many women, warning signs are quiet, unusual fatigue, persistent shortness of breath, nausea, or a dull ache in the upper back, left shoulder, neck, jaw, or teeth, even without classic chest pain. If any of these last 10 minutes or come with faintness, cold sweat, or nausea, don't wait. Do 3 things. Stop and sit, semi-recline. Note the time symptoms began. Check pulse breathing, BP for 5 to 10 minutes. Then call 911 if not improving. Don't drive yourself. Use an ambulance. Higher risk after menopause or with hypertension, diabetes, high cholesterol, kidney disease, smoking, inactivity, or early family heart disease. Protect your heart daily. Mediterranean, dash eating, less salt, sugar, trans fats, 150 minutes week of activity, plus 2 strength sessions, 7 to 8 hours of sleep, stress management, and regular checkups. Keep this mantra: 3K, 10P, 115. Short of breath, knocked out tired, cold sweat, 10 minutes, call 911. Dear friends, I'm a U.S. physician who works a lot with adults over 50. Have you ever felt confused between chest pain from the heart and a panic episode? One of my patients, Linda, told me, "Doctor, I thought I was just panicking," but her ECG showed real reduced blood flow to the heart. Here's what I want you to picture: a heavy, squeezing, pressure-like pain that's hard to point to one exact spot, usually in the center or slightly left of the chest. It lasts more than 5 to 10 minutes and doesn't go away with rest. It may spread to the left shoulder, back, neck, jaw. This pattern is especially common in women. It can come with shortness of breath, cold sweat, nausea, lightheadedness, and profound fatigue. It often starts with exertion, climbing stairs after a big meal or in cold weather. That's an urgent letter from your heart. Anxiety, by contrast, often feels like a sharp pinpoint jab that comes and goes with emotions. Changing position can alter it, and slow breathing usually eases it. You might notice shaky hands, tingling in the fingers, shallow breathing, and a fear of, "I'm about to die." But if you calm yourself, it settles quickly. Golden rule: if it's new, getting worse, lasts more than 5 minutes, or comes with shortness of breath, cold sweat, nausea, or faintness, treat it as a heart problem. Call 911 immediately. Don't drive yourself. If it turns out to be anxiety, we'll care for your mind. If it's the heart, you've just protected your life. Did you know that after age 50, your risk of a heart attack rises sharply? But here's the good news. With just a few small daily changes, you can absolutely prevent it. Start with these 3 simple steps. Eat more vegetables and whole grains, and cut back on fried foods. Walk or do light exercise at least 30 minutes a day. Keep your blood pressure, cholesterol, and blood sugar under control with your doctor's guidance. These small habits are the key to protecting your heart and staying healthy after 50. Have you ever felt a sharp pain in your chest when you take a deep breath and told yourself it's probably nothing? I've met so many people who thought the same until that pain turned out to be the last warning from the heart, the lungs, or from a blood vessel that's starting to block up. Today, I want you to join me to learn about the 5 most dangerous kinds of chest pain, the signs that, if you catch them early, could save your life or the life of someone you love. I want you to imagine this. Your lungs are like 2 doors breathing life in and out. When a blood clot gets stuck there, air can't pass. That sharp pain, the sudden breathlessness, sometimes coughing up blood, that's your body screaming for help. If you notice those signs, don't hesitate. Call emergency services right away. Another patient of mine had one-sided chest pain after a minor fall. It turned out his lung had partially collapsed from a pneumothorax, something many people never expect. Sometimes the pain comes with fever, a cough, and phlegm. That could be pneumonia, and it needs early treatment to avoid complications. And here's the thing: not all chest pain is the same. A heavy squeezing pressure that spreads to the shoulder or jaw is often your heart calling for help. In that moment, time is more valuable than anything. If the pain feels like it's ripping you apart and shoots into your back and you feel dizzy, that could be an aortic dissection, a condition so dangerous that even minutes of delay can decide life or death. I'm not telling you this to scare you. I'm telling you so you'll remember. Every pain carries a message. When your body says, "I'm short of breath, I'm hurting," listen. Don't tough it out. Don't wait until morning. Timely action can be the greatest gift you give yourself and those you love. Have you ever been sitting quietly and suddenly felt a heavy hand pressing on your chest? Your breath shortens, and your heart feels like it might burst out of your ribs within a few beats? If your first thought is, "I'm probably just tired," pause for a second. Many people over 50 said exactly that before a heart attack struck. In this video, I'm going to be blunt with you about the signs you must not ignore, and exactly what to do in those critical minutes. because sometimes knowing what to do at the right moment saves a life. I want you to remember this. When chest pain comes with shortness of breath, your body is sending an emergency signal. It's not just discomfort. It could be your heart crying out for help. One of my patients, Mrs. Linda, told me her pain felt like someone had placed a hand on her chest. Not horribly painful, just a heavy pressure. But she also felt short of breath and broke out in a cold sweat. She waited thinking it would pass, and nearly didn't make it to the hospital. If the pain is a squeezing pressure that spreads to your neck, arm, or back, think heart. If the pain is sharp and changes when you move or take a deep breath, it's more likely a muscle or rib issue. But if shortness of breath comes with sweating, nausea, or dizziness, that's a red light. Call emergency services right away. I know people worry about bothering others or making a fuss. Trust me, 5 minutes of hesitation can cost you a lifetime. While you wait for the ambulance, help the person sit semi-upright, loosen tight clothing, and keep them calm. If they have nitroglycerin prescribed by their doctor, use it exactly as directed. As for aspirin, only take it if a medical dispatcher or clinician tells you to. And after the episode, don't stop there. Care for your heart every day. Control blood pressure and blood sugar. Eat well, move gently, and keep up regular checkups. Small choices now are the shield that protects you tomorrow. I've seen many patients make remarkable recoveries simply because they listened to their bodies a little earlier. So if there's one thing I want you to take away from this video, it's this. Never ignore chest pain with shortness of breath. Sometimes that's the last whisper from the heart. Please, listen in time. If you or someone next to you has new chest pain with shortness of breath, treat it as an emergency. Call your local emergency number immediately. If you found this helpful, please like, share, and subscribe for more videos on recognizing and saving the heart.